Hi everyone, this is Dr. David Kulla with Synergy Wellness. We have a patient here. We're not going to mention any names. That's why we have her face blurred out. She chose to do that for her privacy, but she was diagnosed with MS, multiple sclerosis, a little bit over 10 years ago, and she's my age and suffering obviously from the common symptoms of MS, the arm going into contraction. So you can see one of her arms is in contraction, the right arm, and then also she's having a difficult time with her speech. So I'm going to have her say some things, and then we're going to track her speech afterwards. And actually, after we treat her with cold laser therapy and chiropractic care, her speech gets clearer, and it's quite noticeable. So I want you guys to hear it for yourself. So why don't you tell everybody when you were diagnosed with MS and what kind of symptoms you have?
10 years, sight and speech.
Anything else?
That's it.
You have back pain, right?
No, not no more.
Not anymore? Okay, well, that's good news. We've been treating her for a couple weeks here. How about your neck, though? That bothers you, correct?
To the side,
What's that?
side. It hangs to the side.
It has, say that again?
Hang to the side.
Yes. So she said that her head hangs to the side. Okay, so as you can see, it's difficult trying to get her on the table. I need help because if I throw my back out, I'm in trouble. I can't help anybody else. We want to make sure I don't do that. Okay, so we're going to start the laser treatment on you. Now, you'll notice she said to move her head in the center, and her head is turned to the side, so it's very hard to move it. And that's part of the MS, the spasmodic episodes in the MS. Same thing with her right arm. So what we're doing is cold laser therapy to help reduce those muscle spasms, reduce the pain, but also, more importantly, to oxygenate the blood and to help with the nerve axons. And I'll get into that in just a second here. Let me just set her up. Okay, so we're gonna sandwich her with two different lasers. Okay, so this one I'm gonna use on the brain. And what I'm doing is I'm gonna use this laser to help oxygenate blood cells, the brain cells specifically, and then also to kind of calm down the nerve axons, okay? And with MS, the body attacks itself, so increasing oxygen levels to the brain and preventing any death to the axon of the nerve is going to help her. And because the body attacks itself and kills those nerves and attacks those nerves, so this will also reduce inflammation. So we're going to get to the Broca's area of her brain, which controls her speech. And now I'm going to have to turn her head more because we're gonna go right over the temporal bone here on her left side. Now, most people have their Broca's area on the left side of their brain, but some people, a small percentage of people, have it on the right side. So again, by doing this, it's going to help reduce inflammation around the brain, also oxygenate the cells, and we've seen some pretty amazing results with her speech afterwards. So we do this, we laser across her neck and her shoulders and right at the brain stem, among other places. All areas that are going to affect and help her with her diagnosis of MS. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.